September is marked as Childhood Cancer Awareness Month, and let us see some of the facts related to childhood cancer. As such, childhood cancer is rare. It makes about 5% of overall child cancer burden. Approximately 4 lakh children are diagnosed with cancer globally each year, and about 50 to 70,000 children are diagnosed to have cancer every year in India. We can divide the cancers in children into two types. One is liquid cancers that are also called as hematolymphoid. Second one is solid tumors. In hematolymphoid, we have leukemias. Most common are ALL, AML, and CMLs. Second one is lymphomas. Lymphomas are Hodgkin's and non-Hodgkin's lymphomas. In solid tumors, organ-wise, it is like in brain, medulloblastoma, glial tumors. Abdomen, you have neuroblastomas, a Wilms tumor. In liver, we have hepatoblastoma. In bone tumors like osteosarcomas and Ewing sarcomas. Muscles-related rhabdomyosarcoma and non-rhabdomyosarcomas. And retinoblastoma in eye. As such, there are no particular signs or symptoms which indicates childhood cancer. But there are some warning signs like notice to have pallor, bruising or bleeding in a child, eye changes like white pupil, new onset squint, child complaining limb or bone pains, having lumps or swellings, especially if they are painless and without a fever or signs of infection. If the child is having or developing abdominal swelling, notice to have fatigue or lethargy or changes in the behavior, unexpected weight loss or fever, persistent cough, shortness of breath or sweating in the night, and if the child is complaining headaches which are unusually persistent or severe and associated with vomitings. Cancers in children are not the same as we see in adults. Childhood cancers are biologically different. They are more aggressive in nature as compared to adult counterparts. On the contrary, children tolerate the treatment better than adults. Survival in childhood cancer is very high. As we can see, in majority of the diseases, the success rate is more than 80%. But unfortunately, there is a stark difference of survival rate noticed in low and middle income countries when compared to high income countries. And some of the reasons for poor outcome noticed in low and middle income countries are lack of awareness, late diagnosis and late referral, inadequate services to cater huge population, financial constraints, advanced stage presentation, lack of strong policies, high abandonment rates, social stigma and gender bias. In treatment, there are three modalities which are used to treat childhood cancer. It is chemotherapy, surgery and radiation therapy.